Tim, welcome back. You've been with us once before.
Yes, ma'am.
I want to ask you, I have a sort of two-part question. The first question is, do you know why the testing in poorer communities, in particular Black communities, has been so lacking? Is it a state issue? Is it an issue in Washington? And what do you plan to do to change that playing field?
You know, one of the good news that's happening in Washington, and give Mayor Bowser a lot of credit for this, there's now an 800 number, an 844 number that people can call for free testing, so that testing in D.C. specifically is certainly more available than it's ever been. Nationwide, we're seeing the same results. As an African American with an underlying health issue, I have hypertension, over 50 years old. I want to make sure that every single person who needs testing gets it as soon as possible. Today, the good news is we have more testing in this country than we've ever had. Better news is next week we'll have a high increase in the number of testing. What I've done is I've started focusing on communities of faith. Churches in our community have a presence everywhere, and so I've encouraged the president, I've encouraged the Surgeon General to focus more resources from testing in those areas. The good news is we also have hundreds in each state of qualified health centers in rural communities and the inner city. We've provided hundreds of millions of additional dollars for those centers so that we can get more testing. And frankly, if you need the care, testing's not enough. So for the uninsured and the underinsured, we provided over $100 billion to make sure that those folks not only get the testing, but the care they need. So we're moving in the right direction by leaps. Took us a little while to get here. I'm glad we're here now, and the good news is the best is yet to come from a testing and a healthcare provision perspective.
I want to make sure I'm not mishearing you. Are you saying that there's more funding for people of faith going to get this testing?
Ma'am.
Oh.
Yeah. Let me say that a different way.
Please, yes.
Yeah, thank you. I'm glad you clarified that point. Here's what I'm trying to say is that in order for us to help the communities of color have the right locations to go visit to get the test, sometimes you're more likely to walk to the church in your neighborhood than you are to find a ride to a local pharmacy or hospital. So I've encouraged the testing to be done at churches, at CVS or pharmacies or hospitals. I want them done everywhere.
Excellent. Thank you for clearing that up. Sonny?
Absolutely.
Thank you, Senator. Senator, all 50 states have now reopened to some degree. South Carolina was one of the first states to ease restrictions, but it's a bit of a misnomer that working class Americans are the ones eager to get back to work, because a recent survey shows 79% of people who've been laid off or furloughed supported keeping businesses closed to slow the spread. Now, my understanding is if these workers refuse to go to work, they'll lose their unemployment benefits. Is that an appropriate and fair decision that we're forcing these Americans to make?
Well, I think you've asked two important questions that sounded like one, but there's actually two. One, I'd say that the African-American community, for the most part, never really had the opportunity to shut down. 80% of African-Americans have to go to work. They can't telework. They can't do those things by sitting at home and getting it done. They have to actually go physically to a place of work. That's why Whoopi's question about testing and providing health care is so critical. As it relates to opening up the economy, there is an incentive within the CARES Act that provides more money not to work than to work. What the conversation and the discussion has been about is making sure that if you can't work and your place is closed, that you get 100% of your benefit, 100% of your pay, and not more than that. The facts are that most people, at least in South Carolina, are looking forward to getting back to work. There's no question that there are some people who are concerned about the environment at work, about the liability at work, and about the whether or not they're going to be exposed to the virus. If we can reduce those concerns, we find that most people will go back to work because they need to go back to work, and that's one of the challenges that we face, is getting that balance right.
Senator, this is Megan. As you know, our economy is in turmoil right now. More than 38 million Americans have filed for unemployment alone, but you've predicted that we will see a sharp recovery in July and August. I really hope that's the case. I'm skeptical. Can you explain to me why we should be optimistic right now?
Well, we're seeing a few things happen. I just think about the the single mother who raised me and how important the job and an increase in activity was to her when I was a kid. And I think about those single mothers today, just like my mom, who need the economy moving. We need activity in the economy. What I've seen so far in South Carolina is because our cases have been relatively static and our hospital capacities are better now than they were when the coronavirus started. That means that we can isolate those hot spots to reduce the spread, ultimately leading to a responsible reopening of the economy. The first few weeks have been very impressive in the number of people wanting to get out there and move around. Our local retail Targets and Lowe's, the buy lows and the shopping centers are seeing lots of activity, and our caseload has not had a spike, and our deaths are where they were before. So I think that's evidenced right now. I also am very encouraged that by the time we get into mid to late June, we'll have a treatment in place, and that will lead us to having more people with more confidence to get back to work and to start spending money. That discretionary income will be spent as opposed to being saved, and that will be good news for the economy that's really driven more by confidence than it is hard facts.
It also seems to be driven by optimism on your part. I think that's a very short window to see change coming. But the House just passed a $3 trillion stimulus bill, $3 trillion, among other things, provides aid to states and local governments so they don't have to lay off our first responders. But seemingly, there's quite a few Republicans who've called it dead on arrival. So do you have an alternate idea? Do they have something that they can say, we can do this instead? Because oftentimes when folks say it's dead on arrival, they don't seem to have an alternate idea. So what are you offering?
Well, a couple of things I'd say, Whoopi, is having run a county when I was in a former life for 13 years, I was the chairman or a member of the Charleston County government, and one of the things you need on the local level are the resources because the revenues are down. What we sent to the states was about $139 billion, and the question was, we put so many handcuffs on it, the governors call and say, I can't use the money in the way that I want to use the money. Take these handcuffs off. And so what happens is when you look at the $139 billion that we sent to states, the question is, can we give them more flexibility? Many of the governors said with more flexibility, I'm not sure if we'll need a second tranche. Most suggest that they might need a second tranche, but the question is how much will that be? And the only way to find that out is to take the handcuffs off in the first wave of resources that we sent to the states and see what comes out of it, what materializes. The second part is we're also creating a low-interest long-term loans through something called a commercial facility for municipalities and counties to be able to borrow money to meet that liquidity need that they have. The question is, with those two things in the current relief bill, what do they do and how do we measure it? And then let's talk about the additional needs that will come after we understand the impact of the current bills.